Hello everyone, this is Dr. Uma Maheshwari. Today I am going to discuss about breastfeeding. First we will see about meaning of breastfeeding. Breastfeeding is the feeding of breast milk to newborn, infant and young children for the nourishment. Next we will discuss about advantages of breastfeeding. The first one is this is very simple and inexpensive method to improve the nutritional status of the children. Also it is very safe, hygienic and free from adulteration. It is very readily available at any time. It increases the bonding relationship between the child and mother. It acts as a natural contraceptive method for the parents. It means if mother is in breastfeeding, the parents doesn't need any contraceptive method to avoid unwanted pregnancies. Next we will discuss about importance of breastfeeding. Breast milk is having IgA and IgM immunoglobulins, to prevent the various infections. Breast milk is having most appropriate protein fat for the baby. It can digest easily. Breast milk contains the more lactose. It provides the high level of energy to the baby. Breast milk also having laxative action. So during the time of breastfeeding, babies are never going to have constipation most of the time. It is having sufficient amount of different vitamins, salt and calcium and iron. Breastfeeding helps to maintain the hydration of the baby. So that's why during the breastfeeding time, especially up to 6 months, we recommend that no need to give any water to the baby. Next, colostrum. Colostrum, it is a yellow serous fluid secretion from the breast for the first 3 days after the delivery. It contains high level of protein, vitamin, sodium and chloride. At the same time, it also have low fat and potassium. It also having high level of antibodies. It must feed to newborn. We can call colostrum as a liquid gold because the nutritional level wanted by the baby can be fulfilled by the colostrum. In some cultural practices, they avoid colostrum to feed the baby, but that is the wrong one. So we must encourage the mother to feed colostrum definitely. Next, content of breast milk. Here this chart shows the how much nutritional requirements can be fulfilled by the breast milk, especially in the amount 100 ml. So we can see here that protein 1.2 gram is available and fat 3.8 gram, calories 66, lactose 7 gram, iron 0.05 milligram, phosphorus 15, zinc 0.12 milligram, calcium 35, vitamin like A, C, D, K also available. It is having 88% water. Next we'll see about the physiology of lactation. Physiology of lactation means how the breast milk is secreted. So first see here, baby sucks the breast. Actually it is breastfeeding process. Secretion of breast milk, it is starting by the baby only. Once the baby sucks the breast, a sensory nerve ending of breast gets stimulation. The sensory nerve endings which is present in the breast getting stimulation, and this stimulation is traveling to the hypothalamus by vagus nerve. Once hypothalamus stimulate, it also stimulate the anterior pituitary gland. What is the work of anterior pituitary gland here? It secretes two important things, that is prolactin and oxytocin. These two are having different kinds of works in breastfeeding. Like a prolactin act on the milk producing cells of the breast. It secrete the milk. So prolactin is useful to secrete the milk, and oxytocin, it contracts the cell around the alveoli in the breast and eject the milk. Next, breastfeeding reflexes. Actually 3 kinds of reflexes are available, that is sucking, rooting and swallowing. Sucking, baby will start to suck when the mouth is touched by finger. You might be seen this very common, whatever things which is touching in the especially lips, so baby thinks that this is a breast, so definitely baby will start to suck. Next, rooting can be done by stroking the baby's cheek from the ear towards the corner of the mouth. When we do like this, baby turn towards the finger side and start to suck. Swallowing, baby used to consume the milk with act of swallow. Next we will discuss about timing and frequency of breastfeeding. From birth to 2 weeks, number of feeding should be 6 to 10 and volume should be 60 ml to 90 ml. Sometimes mothers feed 6 to 10 times, but amount may be less than 60 ml. Then that should not be a good breastfeeding practices. 2 weeks to 1 month, 6 to 8 feeding per day. Volume should be 90 ml to 120 ml. 1 to 3 month, 5 to 6 times. Volume 120 ml to 180 ml. 3 to 7 month, 4 to 5 feeding should be there, 180 ml to 210 ml. And at the last 7 to 12 month, 3 to 4 feeding must per day, 210 ml to 240 ml can be feed. Next, duration of breastfeeding. According to World Health Organization, exclusive breastfeeding must be given up to 6 months of life. It means after the birth of the baby up to 6 months compulsory breastfeeding should be done, even no need to give any water. And after the 6 month, along with the weaning practices, breastfeeding should be continued. It can go up to 2 years, even beyond, according to mothers. Next, we will discuss about position of breastfeeding. Here we will discuss 4 kinds of position. Number 1, cradle hold position. We can call this position as a classic position because this is very comfortable to all kinds of mother. In this position, the infant head should be kept at the antecubital space of hand at the levels of mother's nipple, with arm supports the infant body and other hand has to hold the breast. So it's very easy to understand. See, the baby's head kept at the antecubital area of the hand, and also mother's another hand kept the breast towards the mouth of the baby. Next, cross cradle hold position, and in this position mother has to sit with her back up, right and right angle to her lap. Then one pillow should be kept on her lap, and the mother also has to hold the baby supporting his head with her extended arms. This is the extended arms of the mother. She kept the head here, and another hand has to hold the breast like this. Next position is the football hold position, and this is very useful for twin breastfeeding. So during this position, mother has to support the infant head in her hand with the infant body resting on pillow. So she kept the pillow here. Also babies on the pillow, and one hand is supporting the head and another hand is supporting the breast. She can keep one more babies here during twin breastfeeding. Next, the side lying down position. This position is very useful for the mother who undergone cesarean section. I mean baby delivered by using surgery. So during this position, mother should be lying on one side of her body like this and slightly raised by using pillow. She kept the pillow here. The baby's body should be turned towards the mother body. Baby's body turned towards the mother body, and the baby's neck has to slightly extended to get correct relationship to the nipple. During this position, we are supposed to careful to avoid swallowing of the breast milk to the lungs. Next, initiation of breastfeeding. For the normal vaginal delivery, breastfeeding should be started within 30 minutes to 1 hour. In the case of LSCS, I mean cesarean section, we can postpone up to 4 to 6 hours, maximum 6 hours. Next, we will see about the steps of breastfeeding. First of all, we have to motivate and prepare the mother with the cleaning of both breasts. Then keep the baby with the slightly neck extended near to the breast towards the mother to avoid breathing difficulty. Then insert the breast and nipple inside his mouth so that baby latches onto the nipples and areola. I will explain latches about in next slide. Then allow the baby to breastfeed for 5 to 10 minutes on each breast according to the need. It means minimum 5 to 10 minutes baby has to feed in one breast. It means both breast has to be used for breastfeeding. Wake up the baby by stroking the sole of his feet or earlobe when the baby sleeps while feeding. Most of the time baby sleeps even after 1 or 2 minutes starting of the breastfeeding. So during the time mother has to be wake the baby by stroking the sole of his feet or earlobe. Next, bobbing. Bobbing is very important to avoid asphyxia. So what is bobbing? Mother has to pat on the backside of the baby after giving breast milk to avoid swallowing of the air. Latch. So what is latch? See, latch is a technical term we are using to describe how the baby attaches to the breast for the feeding. Here some principles are available, like keep the baby in correct position first of all. Then baby should open the mouth wider like this. Baby's lower lip turned outward. It means this lower lip slightly turned outward. Baby's chin touch the breast here, this area. And baby catches the nipple and areola by mouth. Both breast and areola should be catched by the baby. Also mother has to hear the suckling sound. So then latch is completed. It means this can be a good breastfeeding practices. Next we will see about feeding difficulties. So this is the due to mother. Long nipple, short nipple, abnormally large nipple, flat nipple, inverted, I mean reversed nipple, sore and cracked nipple can increase the difficulty of the breastfeeding. Due to the child maybe cleft lip and palate, blacked nose due to some kind of infection, and preterm baby. It means the baby's birth happened before the 37 weeks of pregnancy. The medical or surgical problems. So these kinds of problem can create the feeding difficulty in the breastfeeding practices. Next we will discuss about complication of breastfeeding. The first one is the engorgement of breast. It is an infection and lactation failure on third and fourth day after delivery. So pain and heavy or swollen breast may be happen. So treatment should be sucking out of the breast milk by using any pump, and warm packs should be applied. Next, mastitis is inflammation of the breast. Treatment options are antibiotic and analgesic. Next one is the breast abscess. It is a pus formation of the breast due to some infection. Pus must be removed with incision and drainage if needed. Antibiotic and analgesic can be. Next we'll see exclusive breastfeeding. Exclusive breastfeeding is the feeding of infant only with breast milk for 6 months. It means baby has to be fed for the first 6 months with only breast milk, because breast milk production is nearly 750 ml to 1035 ml per 24 hours. So this is more than enough. Mother has to avoid giving even water to infant. At the same time, vitamins, minerals and other medications can be allowed. So feeding of anything like honey, sugar water, etc. except breast milk can cause risk of infection. That's why these kinds of things like honey and sugar water should be avoided. At the same time, breast milk should be promoted. Not enough milk. What is not enough milk? You might be heard that always mothers tells that enough breast milk is not secreted in the breast. So what may be the causes? Maybe not breastfeeding often enough. I already said that during the physiology of lactation, milk production is starting when the baby sucks the breast, right? So if oftenly if mother is not feeding the baby by using breast, then absolutely this physiology of lactation failed, so milk cannot be produced. Then another reasons are too short or hurried breastfeeding, and night feeds stopped early, poor suckling position, poor latch, or poor oxytocin reflexes, or lack of confidence, anxiety, engagement, or mastitis. In what management are available? First of all, put the baby to breast frequently, baby to be correctly attached to the breast, latch should be proper, build mother's confidence. Next, I would like to talk about expressed breast milk, EBM. Expressing milk means squeezing milk out of breast so that can store it and feed it to the baby later. So next, indications. So why we need to do EBM? For example, if mother is sick, any other local breast problems, or preterm or sick babies, working mother. So these are the indications. Actually, once mother is sick means she cannot be sometimes feed properly. Otherwise, she is having other breast, local breast problem. Preterm babies unable to suck properly. So once the sucking is not proper, definitely milk production will be very less. So during the condition, if mother is squeezing the milk, and she can just directly feed to the baby. And a working mother, it means mother is going for job, then she can store the breast milk in a refrigerator, so the person who is taking care of the baby can be feed later. Storage, how to store? First of all, that container we are going to store should be very clean, and it should have wide mouth, right? And it also should be closed with a tight lid. And for 8 to 10 hours this breast milk can be kept in outside, it means in room temperature. Then if you want to store the breast milk for 24 hours, it should be kept in the refrigerator. Suppose the breast milk can be even stored for 3 months in the freezing temperature, like minus 20 degree Celsius. Okay, the last one, expressed breast milk. How to do, how to remove the breast milk from the breast. So here there are three ways are available. Number one, hand. Look at the picture. By squeezing the breast, we can remove the milk directly to the bowl. Handheld breast pumps are available, and sometimes electric breast pump also available. These three methods we can use to take the milk from the breast. And finally, thank you so much for listening me patiently. If you have any doubt, please message me. I will definitely reply. Thank you.